Health Minister Dr. Mkhize warning of a big spike in COVID-19 cases across the country. And this is after a worrying increase in active cases recorded in all provinces except the Eastern Cape. Districts of concern, so to speak, have been identified where an average of 20% in cases are spiking over 2 weeks. That's as we've been watching the situation. In the Northwest specifically, a spike has been registered in at least 3 districts. That province recorded between 128 and 200 new daily cases since the start of this month. For perspective on how things are faring there, let's bring in the Health MEC, Madoda Sambatha, who joins us now via our video link. MEC, thanks very much for your time. Great to chat to you. So last time I checked, there were about 4,000 active cases in the Northwest. That puts it among the top 5 provinces in this country with the heaviest active caseload. You must be concerned.
Thank you very much, Ayanda, and listeners at home. Of course, we are concerned whenever there's an increase of COVID-19 cases. If you check the provincial perspective, we've done 344,990,000 cumulative tests. Of that, 69,291 have tested positive. 64,000 have recovered. As we speak today, we have 3,500 active cases. Of course, the main problem with active cases is whenever you record the higher number of new cases, you will increase on active cases. The recovery rate provincially is 93%, lower than the national rate of 95%. For 69,000, we have recovered 64,000. That too is a concern for us. But what we see, it's an issue where people, when they were told we are at lockdown level 1, they never thought that lockdown level 1 means economic activities. They had concluded that lockdown level 1 means lower risk of COVID-19 transmissions, which is the main problem that we are facing during this time. The only advantage is that we still have lower rate of hospitalization. We still have very minimal rate of people who are admitted needing ventilation. So with that, we're still safer, but the numbers are not safe for us. But if you were to compare second wave increase, in second wave, we almost had 1,700 cases per week, which was the highest. Still now, we've not yet gone there, but we don't want to even go there because our preparation is that third wave must have minimal impact in our community, and that we must thus have higher rate of people who are getting vaccinated. And that process is still controlled by national government, and we're working with government to do that.
Right. We'll speak about the preparation in just a moment. I wonder, in your evaluation, where you found the risks are. Where do you feel the province is most vulnerable?
Vulnerability of the province, it's predominantly first in 2 districts. Ngaka Mutiri Mulema, which constitute Mafikeng and surrounding towns. Dr. Kenneth Kaunda, which is Matlosana. Predominantly, you find the highest concentration in areas where there's too much people movement. It's either it's movement during the day, on shopping hours, or it's movement during weekends when people are attending to areas of entertainment. And that's the increase that we see provincially. It's where there's concentration of people in higher numbers. And that's why we keep on telling people that they must avoid congested areas. But when you check in schools so far, it has not appeared that transmissions are school-based. Transmissions in school are higher, but they appear the rate of transmission in society, because when they go to schools, they are forced to be tested, and that's when they then appear to be highest. But when we do community testing around the same areas, people don't come out and go for tests, yet they go to test because in workplaces predominantly, They are forced to do a test and then they appear positive there. Yet it's not yet workplace transmissions. It is predominantly community transmissions.
And this is all happening in a context where some hospitals like the one in Orkney are vulnerable to being attacked. You were on this station at the time when you had just learned that illegal miners were attacking, I think it was Westvale Hospital in Orkney. How worried are you about that kind of threat affecting your response to the pandemic? Because you know, of course, you can use all the help you'll need from all the institutions, including Westvale, which you've explained has remained quite vulnerable to criminal activity.
Ayanda, we must also thank your station for having made community awareness for the serious challenges we had in Westvale. People now in the surrounding areas are now aware of the challenge we have. In actual fact, it has helped us to reinvigorate the response from the South African Police Service. Of course, from that time, we now have a joint operation focusing in the area. And like you are saying, it's vulnerable. It's vulnerable, but also to be truth to you is that it is the area that has admissions high on the basis that it's admitting for the province in wide whoever is highly in need of ventilation. So in this instance, we're working all the time with subs. Of course, now they are highly aware because you manage to popularize the intervention that is needed there. Ministry of Mineral Resources came to intervention. Ministry of Police came to intervention. Ministry of Health came to intervention. Currently, we are on the ground. And what we can't say, we can't relax and say we've had a successful intervention. Zamas are planning on each day on the basis of need for them to access copper-related materials. And on ourselves, we're protecting the hospital. And we will also understand that the attack was predominantly on the side that has not been used. Of course, between ourselves and Harmony, who's the owner of the hospital, we've now had agreed as to who takes responsibility of each site in the hospital.
Yeah, and I presume you haven't been able to find those people who invaded the hospital on that day.
You know what is surprising, Ayanda? Just 200 meters from the hospital, during the day, there were people digging to access copper. When we tell police, those people are digging to access copper. If they get that copper, it means the hospital would be offline permanently. Police then says, no, those people are not in your site as a hospital. They are 200 meters away from the hospital. Therefore, a person who must lay a complaint is the municipality. We could not believe that until we instructed our own security to chase them. They then caught 2 of them, of those who were digging copper, and then apprehended them, handed over to police. Of course, the argument is that the case should be opened by the municipality, yet we are witnessing with police vandalism.
Sure. The political landscape in the Northwest has also been in the headlines for quite some time. I mean, many people might struggle to connect the dots, but it's very easy to see how any kind of political upheaval in a region could affect things like that province's response to COVID-19. Between Supra Mahumapelo and Job Bukhoro and the relationship they have with the ANC and with you as a political appointee in that province, how are those developments affecting whatever strategy you have in place to respond to the pandemic?
The political instability in the province, unfortunately, has always have an impact in service delivery. You can look that throughout local government, but also in provincial departments. Here, what you have is that factional disagreements and factional fights then get extended to departments wherein your interventions could easily be undermined on the basis of how you are viewed by dominant factions. They could even be undermined on the basis of what are their factions fighting about. Remember, dominantly, some of these factions are not fighting any political fights. The fight is predominantly about access to government resources for accumulation for personal purposes. And whenever you appear to stand opposed to any accumulation of wealth through government developments, you appear to be then the target for the factions. Predominantly, the issue here is where the ANC comrades have conclusively determined themselves as being the ANC itself, and that nobody else could ever lead the ANC without them, and thus then create an element where people believe they own the organization, and therefore nothing could be done to them, even if they are wrong, on the basis that they are seen to be owners of the organization. What has to happen is that the issue of discipline must be instilled irrespective of a position a person holds. But what must never be allowed is individuals having access to state resources purely for personal gains, because it is the same access to state resources that then gets used to fund factional battles in the province.
Sure. Sobering reflections that, especially as we sort of mark this important moment in our response against COVID-19. Thanks very much for your honesty. Madoda Sambatha is the Health MEC in the Northwest. Thanks very much indeed.